Bismillahirrahmanirrahim. I am going to discuss certain labor related scenarios with you because different questions in the exams comes related to the labor, and we have to make decision depending upon the situation, depending upon the gravity, dilatation, the station, the position of the head, the duration of the labor, and whether epidural is given or not, and the capit and molding. Okay, like for instance, we have scenario number 1 in which we have a primal gravida. Okay, the first pregnancy, primal gravida. The gravidity is important because we should know that how much should be the duration of the labor in full dilatation in case of the multi and in case of the primal. Okay, so she's primal gravida, she's fully dilated. Okay, vertex is at +1 station. You can see it is at +1 station. The position of head is occipito oblique. Okay, whether it is right occipito oblique or left occipito oblique, it doesn't matter. Okay, and 2 hours has been passed since full dilatation. Okay, she is fully dilated for 2 hours, and epidural, no epidural has been given, because if epidural has been given in case of the primary, we can wait for about 2 hours. Okay, and as far as CTG is concerned, fetal heart rate and CTGs are normal. Now we have to check whether she has got molding, the baby has got molding and capit formation or not. So we would say that there is no molding and no molding and no capit formation is there. Okay, no capit and no molding, no capit formation is there. Head is at +1 station, and time is sufficient. Time is sufficiently passed. Now we have to take the decision. Okay, in that case, as there is no molding and no capit, so first of all, before going for C-section, okay, we want to avoid the C-section, so we want to go for the instrumental vaginal delivery. And instrumental vaginal delivery, we have the different options like vacuum, we have the options like forceps. Okay, the forceps will be chosen depending upon the station. Here at +1 we can apply the mid-cavity forceps, but the thing is that as we have no molding, no capit, so, and the head is also not rotated enough, then in that case the choice would not be vacuum rather than forceps. Okay, because we don't have any capit and molding, so vacuum is better in this mal-rotated head. Okay, so the answer would not be ventouse delivery. Ventouse delivery is the answer. Okay, and I have made certain notes to show those to you. There is a chart. Primal gravida, position occipito oblique position, fully dilated for 2 hours, head is at +1, no capit, no molding. CTG, for instance, you can say it is normal, but the time is sufficient. Okay, so in that case the management would that be ventouse. Now come to another scenario in which we have primal gravida. Okay, and she is fully dilated for 2 hours, no epidural has been applied. Okay, and when we do pervaginal examination, we found that the head is at station +1. Okay, station is +1, but we can also see a little bit capit formation as well. The capit is up to the level of +2. She has capit up to +2, although molding is nil, but capit is there up to +2. Okay, primal gravida, fully dilated for 2 hours, capit is there, but head is at +1. Okay, now come to the position of the head. We found that the position of the head is okay, it is not rotated. Okay, it is means occipito. If we consider this as the pubic symphysis, then and this is the sacrum, then we find that this is the occipito anterior position. Occipito anterior position. Okay, head is not malaligned. Okay, it is rotated, but the thing is that there is a capit formations. Head is at +1. Okay, so if there is capit formation, we cannot go for the vacuum. We would better choose the forceps. Okay, and another important prerequisite for the forceps is that the head should not be rotated. Okay, the occipito anterior, occipito posterior position is okay for the forceps. Now, which type of forceps needs to be applied? At +1 position, we apply the mid cavity forceps. At +2, the lower cavity forceps, and +3, the outlet forceps. So if the head is at +1, we will go for the mid cavity forceps like navel barn forceps. Okay, so the management of the choice in this case would be navel barn forceps. Now there are two different situations in which there is a primary gravida, or you can say multi-gravida, whatever the situation may be. She is in her first stage of the labor, in active phase of the first stage of labor. The cervical os is 6 centimeter dilated, and head is you can say about 0 station, -1, or it may be at 0 station. Okay, but when we try on provisional examination, when we try to find out the position of the head, we find out that it is the mento-posterior position and the face presentation with a mento-posterior presentation. Okay, although patient has not reached its second stage of the labor, but we will decide to do C-section of this patient. Now there is another situation in which we have primary gravida or multi-gravida. Cervical os is 6 centimeter dilated, head is you can say at 0 station or above 0 station. But when we try to find the position of the presenting part, we find out that there is a bro presentation of the baby. Okay, in that case it has been shown that we can wait. If the CTG is normal, if fetal heart is normal, we can wait till the second stage. So that is different from that the mento-posterior presentation, in which we can take the Descions straight away, but in bro presentation we have to wait till the second stage of the labor. And in the second stage of the labor, if the position persists and if there is delay in the second stage of the labor, depending upon the primary or multi, then we can take the Descions according to that.